Hi, my name is Robert Kozlenko, and I'm a clinical informatics specialist at NYU Langone Health.
And hi, my name is Meg Ferriola. I'm an application lead of the Epic Inpatient Orders team. And we're here to talk to you today about reduction of CLABSI incidents using a central line maintenance best practice advisory.
So I want to talk to you about our challenge. Basically, we have a 12-bed MICU in our Langone Brooklyn division. And in the first 5 months of 2021, we had 808 central line days, during which our CLABSI incidence rate was elevated at a monthly average of 9.1. And CLABSI, central line associated bloodstream infections, are known to cause different poor patient outcomes and lead to increased hospital stays, plus have a financial impact. And we know that the best way to deal with CLABSIs is to prevent them. And prevention equals maintenance, or maintenance equals prevention. So we can prevent it using aseptic techniques, surveillance, and management strategies. So for us was, how do we reduce our CLABSI incidence rate? We had already created a CVL maintenance order set back in 2018 that was based on various evidence-based practice guidelines and included orders for things like CHG dressings, flush orders for access and non-access lumens. Additionally, things such as reminder orders for changing needleless access IV valves or IV valve caps. And these orders were made to serve as both a way for a nurse to document that they were giving medication, saline and heparin, as part of the flush, or to give them a visual reminder in the MAR to do something which they may not remember to do. Because even though these were part of our standards in practice, sometimes you may be a little bit harder for someone to remember to do something such as flushing a non-access line if you're not using it. Meg?
So our process was that we observed the central venous line maintenance order set was not always placed. So we wanted to figure out the best approach for our patients to get these orders. And how did we decide to promote the usage of our order set? We went towards clinical decision support. Clinical decision support systems are computer-based programs that analyze data within EHRs to provide prompts and reminders to assist healthcare providers in implementing evidence-based clinical guidelines at the point of care. In our EMR Epic, we chose an interruptive best practice advisory. We studied our provider's workflow, and we had it happen where the provider documents the insertion of a CVL in their procedure note writer, which automatically creates the order behind the scenes. And at that point is when we're firing our interruptive alert, presenting the order set to the provider. Before we went live, we sent the BPA to production behind the scenes so that we can monitor it to ensure that it aligned with the 5 rights of CDS. We wanted to make sure that it was firing for the right patients, the right users, and giving them the right information. We used reporting tools to trend and verify that it was firing appropriately. And we went live on May 19th, 2021. After we went live, we verified that the providers were using our order set, thanks to our BPA, and we monitored reporting using a slicer dicer. For the 65 unique patients that the BPA fired during our evaluation period of June to December 2021, 72% of the patients, the provider placed the maintenance orders from our BPA. 18% of the patients, the provider chose the acknowledgement reason that they were going to place the orders outside of the BPA, and they did. And 9% of the providers indicated that they replaced the order, but no order was actually found.
And our end result, which is the outcome measurement, we realized that the CLABSI incidence rate fell to 0 for the 7-month period, June to December 2021. And during that time period, the MICU had 405 combined central line days during this period. So the lessons learned we had were we combined evidence-based practice and CDS, which contributed to a significantly reduced CLABSI rate in the MICU.
Our evidence-based tools in the system were combined with CDS to bring them to the user's awareness, and CDS alerts should display for the user with the ability to act on them at the right time, which maximizes the alert's value.
And if you'd like any more information, please reach out. This is our contact info. And we just want to thank you for listening to us share what we learned. Thank you.